All right, now to our first conversation. We see inflation numbers for May. That show a rise of 33.95%. But digging deeper into the contribution of items at the divisional level, we see health contribution year on year to these inflation numbers, 1.02% jump there for May. Health contribution also for the month-to-month level, I would say about 0.08%. So we're seeing a rise there with contribution of health into the headline inflation that we have. All right, let's chart the way forward now with Dr. Enna Taiches, the CEO and founder, Get Medco, joining us from our Abuja studio. Great to have you. Good morning.
Good morning. Thank you so much for having me.
So talk to me about how you see Nigeria's healthcare sector, at this time, and your thoughts on how we got here. We see how much people are spending for pharmaceuticals at this point.
Yes, let's just say it like this. There is a way forward, and there are significant improvements happening even as we speak. Unfortunately, we're way behind the 8 ball, and there's a lot of catching up to do. So when I look at the Nigerian healthcare sector, there are 5 issues that I think are prevalent that need to be addressed. One is, and I coined the term TRACE, the acronym TRACE, which stands for training, retention, accountability, consequences, as well as equity. So the A is also for access as well. And I think that these 5 things are really the pillars on which the recovery should stand. We need to train our physicians better so that they can even be up to world standard. There are a lot of gaps. Even as far as retraining them, having them do exams and making sure everybody is up to date, retaining our physicians. We know that that's a big issue because many of our doctors are leaving for greener pastures, as it were, in other countries. So these are the major issues that I believe are afflicting our system at this time. And inflation is huge. Unfortunately, that's as a result of our economy. So now drugs are much more expensive, and you can imagine those who have to take chronic medications for diabetes, hypertension, what they have to pay now. Those who are on dialysis, how much they have to pay for each session. It's really a big issue, and I'm hoping that with the coming changes that these can be improved.
Right, and definitely, talking about the prices of pharmaceuticals at this time, we see the federal government making some moves right now with an executive order slashing taxes on pharma inputs. What do you think would be the immediate impact of this?
Well, I think apart from slashing taxes, we need to make sure that there's a follow-through in the reduction of the cost of these medications, especially to those who are not able to afford the medicines. So, for example, in the U.S., we have subsidies. So the government provides subsidies so that the medications are not as expensive. And I think that this is so important for the government to say, apart from slashing taxes, how can we inject the system so that we have less financial burden to get these medications?
All right,
and also, the other side effect, I'm sorry to interrupt you, the other side effect is that people will start going to other routes to get medications that may not be the right medicines or that may not be verified by the Drug Association.
Right, because we see some people having to fall back to agbo, at this time, because
exactly.
We see how much these medicines are. But talk to me about medical tourism now, still a burning issue right now. But with currency volatility, how would you describe the rate of medical tourism to and outside Nigeria, at this time?
Yes, Nigerian doctors make up over 10% of Black doctors worldwide. That's a huge percentage. And, now in the UK and Canada especially, there's a huge dearth of physicians. So what they're doing is they're coming to Nigeria to say, let's get all these doctors into our country so that they can, help us with our healthcare situation, because they also have a numbers situation there as well. So they're, beckoning to these doctors, and they're telling them, hey, we'll give you housing, you can bring your family, you can even bring a nanny, you can bring whatever you want, and we'll provide all these things for you. And it's hard to compete, because when you look at the salaries, when you look at the infrastructure, you know, these are the two things that are bringing that are making the doctors decide to leave Nigeria. So we do have to look at our compensation structure, because it does not compare to our counterparts in other parts of the world. And so it's hard when you now have an open door where there's no immigration issue to choose to stay here when you have to provide for your family and you have to make a better life for yourself. So I think that we do have to take a hard look at the physician salaries, at the healthcare salaries in general, and really pay more attention and more respect to these important institutions.
All right, let's look at investment in the sector this time. We've seen the central bank MPC, they've moved to tackle inflation with interest rate hikes, increasing the cost of credit at this time. What would you like to see, going forward, can boost healthcare, the healthcare industry? You're talking about investments, FDI, at this time.
I think that we have to find a way to incentivize people who want to invest in the healthcare sector, meaning that, they should be guaranteed a higher rate of returns. You already mentioned it earlier, the tax implications, all these things. I think, once you reduce the red tape, as it were, to these institutions, you will get an increased influx into this, and also guaranteeing some level of returns. Healthcare is a big booming business right now. Even the number of, diaspora physicians returning home, it's really impressive. People do want to come home, but what they want to ensure that there's infrastructure. So I think infrastructure is a huge opportunity for investors. I also think that hospitals and satellite centers, so that people can get care, have access to care wherever they may be, I think it's really, really important. So I would say, however, we can reduce the bureaucracy for investors to come in, particularly for healthcare, I think the government should look into that.
All right, what about personalized healthcare? Talk to me about what kind of solutions this is actually bringing.
Thank you. So personalized healthcare, let's start with the definition. It's really a style of medicine or an art of medicine which improves significantly the patient experience as well as physician outcomes. It's basically physicians saying, I'm not going to treat you as one of many. I'm going to treat you as one of one. I'm going to listen to you. I'm going to hear you out, as opposed to a lot of times the paternalistic approach that a lot of physicians have. Now it involves you sitting down at eye level with the patient, you listening to them, you looking at their entire situation, their socioeconomic status. Can they actually afford the medication that I'm recommending? Can they actually afford the hospitalization that I'm suggesting, or the surgery or the procedure? So it's really looking at the totality of the patient, looking at their whole personal outlay and saying, how best can I support you with this condition that you have? And really what it does is it gives the patients agency. And because they have that agency, they're more involved in their health care. And then we see dramatic improvements in their outcomes, in their numbers. So blood pressure, diabetes, even cancer outcomes and so on, because they feel like they were given some level of control over their health. So that's really what we're trying to push at GetMedCo, that with every client that we have, you will have that personalized care. We won't treat you like, oh, just the next patient that walked in. We want to know everything about you. We want to know your fears. We want to know your concerns. We want to know, what do you think about, what concerns you the most about what's going on right now? And I think that if you treat each patient like this, and this is really just an extra 5 minutes in your visit, if we do this, if we make this investment, we'll see a dramatic improvement in healthcare outcomes.
Talk to me about your outlook for Nigeria's healthcare industry, at this time, seeing all the challenges we have at this time and seeing how the federal government is trying to help boost this industry at this time. What are you seeing in the future for Nigeria?
So what I see it's going to be a long road. I see it's going to be a long road, but it's not an impossible road, and it's not a hopeless road. The unfortunate situation is we are reacting now. I wish that some of these changes that are taking place now happened before the massive exodus of physicians. So now there has to be a significant pull to bring diaspora physicians back, and also to increase the number of physicians, the number of prospective physicians in our schools. We also have to bring diaspora physicians and educators back so that we make sure that the education that these new doctors are receiving is up to par and up to world standard. So I do think that, you know, Nigeria is headed in the right direction, but it cannot be one thing at a time. We have to have, like I said, we have to address these 5 different pillars so that we're moving forward together. And, you know, in the next 5 years, you know, we will see a dramatic increase. You know, there was a time that Nigeria was on par with the Western world in terms of medical care and medical education. And I believe that we can get back there. And we need to be able to attract our physicians abroad to come back and, you know, give a month, give 2 months in the year. And if the more physicians that we have, the more that we can do this. And I know a bunch of my colleagues who are willing to come back. We have a lot of Nigerian physicians who are happy to come back home, not permanently yet, but at least for a time period so that they can help.
All right. Come back home this time. Thank you so much. It was great having you, Dr. Enna Taiches.
Yes, thank you so much.
And founder at Get Medco. Thank you so much.
Thank you for having me.
All right, we'll take a break now. When we come back, we head straight to the commodities market. That's in a moment. Just stay with us.